my shoeless shoes.
Less common conditions that we'll see, one of them is called tarsal coalition. And one simple way to think about this is a rigid flat foot. So most kids are going to have a mobile flat foot where you can move it between supination and pronation. But if a kid has a rigid flat foot, it's usually a coalition. What a coalition means is there's basically a bony bridge where there should be a joint. So, and again, this is a smaller picture, but there's a bridge here between the heel bone, the calcaneus. Where did I go? And the talus right here. So two bones that should kind of glide and move and be flexible are actually locked together. This is a surgical problem, and so it's something that you can't really treat with footwear. I wouldn't say can't. I mean, I have had patients where I can treat them with orthotics and they'll do fine, but there isn't a shoe that helps with this. What happens with this one is this one happens actually a little bit later. So a child that's still skeletally immature may not have symptoms because that bridge hasn't ossified or calcified yet. So they won't have too much of an issue when they're younger. But what I'll see in clinic is a parent will bring in a kid and they'll say, he keeps spraining his ankle. And to them it's an ankle sprain, but if you look a little bit closer, the pain ends up not being at the ankle. It's actually in a different place. And it's not truly a sprain. It's just that they can't move properly, so they overload other structures. So if you hear someone talking about chronic ankle sprains, or my kid needs a shoe that's going to help with their ankle sprain, I wouldn't say that I would steer them towards a high top shoe right out of the gate. I would say that might be something that needs a little bit closer look with your doctor. And again, this will be someone that would be up above. These are even more like teenagers, like probably between 12 and 18 is when I'll start to see this in clinic. Sometimes you see it a little bit younger. And it's not that common. And then other less common conditions are juvenile bunions. You do see some kids developing bunions. You will see congenital curly toe. So a lot of times that's a family trait. Again, a small picture, but the toes might contract a little bit. Or a shorter toe. It's called, that can be related to brachymetatarsia, which is a shorter metatarsal leading up to that toe. Those are just minor deformities. Most of them don't need to be addressed surgically. They just make it a little bit trickier to fit the shoe sometimes. And you guys, you would employ the same principles you use for an adult that might have a bunion or a hammer toe. Just trying to find something that's got some room in the toe box and a good fit. So the part that ends up making it tricky again is, if we come back to, how do we speak to the parent and help fit that child? There are conflicting recommendations that you'll find even within my own profession, and I've got a slide coming up on that. But in general, most pediatricians, podiatrists, orthopedists that understand footwear are going to recommend a flat-soled shoe and really to look at the shoe as just something to protect the child's feet so they can be active. Nothing more than that. But if you look at what a parent may want to do, they feel like they're doing their child a disservice if they don't get a very supportive shoe or get an arch support for them, or that they want to have a shoe that has a ton of cushioning. I even came across a blog post by a podiatrist who is really concerned about the whole minimalist movement affecting child's shoes. I don't really have that concern. And this is something I pulled off the internet. Actually, I pulled this off of the American Podiatric Medical Association's website on how to recommend child's shoes. And what they did, and I'll show you these pictures, so it says brought to you by Stride Right. So I think these are Stride Right's images, and then the APMA has a relationship with Stride Right, and basically they're advocating this. So they say, does your child's shoes make the grade? And there's a 1, 2, 3 test. So the first test is look for a stiff heel. So they're showing someone pinching pinching the heel counter. The good one shows this not buckling in, and then the bad one shows it being able to be pinched. There's no research that shows a rigid heel counter controls the heel. The only study I saw that showed that it might is one where the heel counter was actually heated and molded to the calcaneus. So that's an erroneous recommendation. There's no data to tell us that the shoe has to be stiff in the heel. The next test is the toe flexibility. So of course they want the shoe to flex up by the toe. So if this one flexes in the middle, according to this test, they're going to say, oh, that's a bad shoe, your kid shouldn't wear it. I don't agree with that. The third test is make sure it has a rigid middle. So they're looking at torsional stability. So they would say this shoe's bad because I can twist it. The shoe needs to be stiff or have a shank there. Again, there's no data to tell us a kid needs a shoe that's stiff. And I would tell you this too. If I'm treating someone with pain, I'm going to look at it differently. I might want them to have a stiffer shoe or a shoe that flexes more up at the forefoot. If I'm just treating a kid that has no pain, no issues, just looking for a good shoe, they can wear anything that feels comfortable. Okay, so, but the difficult position that you get into when it's a parent is if the parent's convinced that 1, 2, 3 fitting program they found on the APMA website and Stride Light recommends, if they're convinced that's the best way to fit a shoe, you're not really going to want to say, oh, let me educate you on how to fit a shoe. So you end up kind of having to play that game a little bit and give them what they want, but there really isn't any scientific data to say, oh yeah, that's a great way to fit a shoe. Okay. You know, what you guys already do in terms of making sure that the width is appropriate by kind of squeezing the upper and then checking that length. You know, for kids, I'd say, you know, using my thumb, which is probably about 2 centimeters wide, I'd say about 1 centimeter, which is about 1/2 inch of toe room, is probably good to allow some room and not still be sloppy. And I always emphasize, not just to parents, but almost anyone buying a shoe, especially an athletic shoe, which kids tend to gravitate towards, the shoe really needs to be snug in the back 2/3. So snug enough to hold your instep steady and to hold that heel in place. And then having wiggle room for the toes. If you don't have enough room to wiggle those toes, even if they're not going through a growth spurt or anticipating a growth spurt, I'd say that shoe's too small. If a parent wants to go bigger than that, we can't always tell them that we'd recommend it, but of course the concerns are that if that shoe's too sloppy, they could get blisters up underneath the forefoot from slipping around. If the kid tends to run a lot, they'll slip forward in the shoe, maybe even get some bruising or blistering or even toenail issues. But it's still, you know, as much as you try to get feedback from kids, they don't always give you good information about what's fitting or feeling comfortable for them. But obviously it's a fine line between giving them some room to grow into, but not being sloppy or problematic as far as that fit. Some of the things I looked at on the internet talk about, you know, jamming your finger down behind their heel to see how much room they have behind the heel. I don't really know the significance of that. I would say as long as the heel is snug here and snug there and they got that wiggle room for the toes, I'm not worried about poking my finger in the shoe to see how much room's in the back there. Again, the flip-flop issue, the main thing I tell parents about flip-flops is that research does show any shoe that has an unsecured heel increases the risk of falling, whether you're a child or an older adult. So I don't see kids getting chronic foot problems from wearing flip-flops, but I do see them slipping on them and sometimes spraining their ankle or fracturing their 5th metatarsal. So if you slip on a shoe and roll out like this, you can sprain the ankle, but that 5th met, the lateral metatarsal, can actually crack. Doesn't happen often, but I see that more than kids getting plantar fasciitis or other foot problems from flip-flops. And then, yeah, the whole idea about how much support and how much cushioning, no one really knows that answer at all. And some of the newer research on that shows there's probably an ideal amount of cushioning for every one of us, but because our movement patterns and our sensory systems are so unique, we don't really know how to predict that ideal level of cushioning, but that's where comfort comes in. So just like you already do, comfort ends up being the primary thing to focus on when fitting any shoe, whether it's a child or an adult.
Put on my shoeless shoes, my shoeless